Today I'm going to talk about foley catheter. Foley catheter is an instrument which is used in acute retention of urine. It is a self-retaining instrument which contains two tubes in the distal end mostly, and a single tube in the proximal end which contains a balloon for dilatation, which can be used for the fixing of the Foley catheter inside the bladder, or it is also called self-retaining Foley catheter, two-way self-retaining Foley catheter. The two-way self-retaining Foley catheter contains one tube in the distal end which is used for syringing of distilled water. It is used for this syringing of distilled water, not normal saline, because if you install normal saline inside the balloon, after some time what happens is the normal saline crystallizes, which will prevent in deflation of the balloon, which will hamper the taking out of the Foley catheter. So we put in the distilled water. The other tube which is present in the Foley catheter is the tube for draining of the liquid from the bladder, mostly from the bladder. Another type of Foley tube is also present, which is called a three-way Foley tube. It contains an extra tube which is used for irrigation purpose. This extra tube helps in irrigation of the urinary bladder. It can be of use during the blood clots or during the frank hematuria. Foley catheter is used in acute retention of urine in conditions such as bladder outlet obstruction, urethral stricture, phimosis, urethral calculi, spinal anesthesia. So the main conditions are bladder outlet obstruction, urethral stricture, then it can be used in cases of phimosis, or urethral calculi, in spinal after a spinal anesthesia during surgery, and then it can be used in spinal injuries. Now let's talk about the scenario in which the patient present. The patient present with the condition of acute retention of urine. When the patient present with acute retention of urine, you have to make sure that it is the acute retention of urine that you are dealing with. To make sure that it is acute retention of urine, you have to take history and do examination. History and examination. These is the two most important part you have to do before catheterizing the Foley's catheter. Now, on the history, there is mainly two components that you have to do. There is history of not passing the urine, and there is pain. And there is pain in suprapubic region. On examination, you have to do abdominal examination. On abdominal examination, there are mainly three findings: on inspection, on palpation, and on percussion. Okay, on inspection, you can see a mass in suprapubic region. On palpation, there is tenderness, and you can palpate the mass. On percussion, the mass is dull on percussion. So now that is the case of acute retention of urine. So you have to do the catheterization. On catheterization, I'm going to talk about the catheterization in male patient. Why I'm going to talk about in male patient? Because in female patient it is just the same as the male patient, but on male patient there are some precautions, or there are some extra steps that you need to do. Okay, in male patient, what extra steps do you need to do? I'm going to talk about that. On the male patient, first you have to take a consent. That's a rule, and then you have to place the patient in a supine position. Okay, you place the patient in a supine position in a bed. you have okay, you place the patient in the supine position, and you have to clean the genitalia with antiseptic solution. Now after cleaning the genitalia, if in the case of male patient which has not circumcised their penises, you have to retract the prepuce and expose the glans penis, and you have to clean the glans penis of the smegma. There is something called smegma, which the foreskin of the glans penis secretes. So you have to clean the smegma so as to prevent the infection, and then you have to use the antiseptic solution or betadine solution in the foreskin as well, in the glans penis as well. After doing that, what you need to do is insert xylocaine solution or lignocaine solution. It is a local anesthesia. You have to keep it inside the urethra. Okay, after placing the anesthesia inside the urinary bladder, into the urethra, there is strictures. So you have to pass this from this to this. So you have to massage the penis from anterior to the posterior area. After so that to make sure that it reaches the sphincter area. Now after you have put in the anesthesia, you have to clamp this tip of the penis with a penile clamp, or you can pinch it with your hand for 5 to 10 minutes so that the anesthesia can work. Why do you need to anesthetize the urethra before putting in the catheter? There are two reasons behind it. One is so that patient doesn't feel pain, and the other is to prevent the activation of the sphincter, which will prevent the insertion of the Foley's catheter. So it will be very difficult if you don't anesthetize the patient before putting in the catheter. Now after putting in the xylocaine solution, what you need to do is, this is the xylocaine. Now what you need to do is put in the Foley's tube. The Foley's tube will go smoothly until the end of the urethra, that is up to the sphincter. After this, you can feel the stoppage of the Foley's tube, which you have to press with a jerky push, and insert it inside the bladder. To make sure that it is inserted inside the bladder, you have to push a little bit further down into the bladder up to the bifurcation of the Foley's tube. The urine will start coming out of the discharge tube, and you have to connect this with urobag to collect the urine. Now after the urine has come out, you have to insert the distilled water through this tube so that the balloon can be dilated and it can be placed inside the bladder so that it does not come out. After this has been done, you have to place the foreskin back so as to prevent the paraphimosis that you induce if you keep the foreskin retracted. Or to confirm that the Foley catheter is inside the bladder, you need to do is X-ray. How can you see a Foley catheter in an X-ray? Is that in a Foley's tube there is a radio opaque line that is colored, which can be seen in X-ray. So this radio opaque line will help you to see that it is in the bladder. If X-ray is not available, what you can do is you can give a suprapubic pressure, which will release some urine inside the urobag. Now what to do in the condition where the patient presents to you with retention of urine, with the signs and symptoms of retention of urine, but when you put in the Foley tube there is no any collection of the urine. It is due to anuria. So the condition is not in the bladder, it can be in the kidney. So it is an emergency condition. In this condition, what you have to do is the emergency hemodialysis. Hemodialysis has to be done in these cases. So guys, that's it about Foley's catheter. Thank you for watching.